Good morning, everybody. Thank you all so much for joining us today for the second session for the Introduction to Grant Writing series through the Global Emergency Medicine Academy. Again, this is our first series, but it won't be our last. We want to continue doing more series. So please check out the Society of Academic Emergency Medicine website and consider becoming a member. Once you're a member of SAEM, then you can be a member of GEMA, the Global Emergency Medicine Academy. And that way we really want to tailor the future of these series towards what people are most interested in. So please become a member, and that way we can have more in-depth series and talk more about specific topics moving forward. So I'd like to introduce the panelists that we have here with us today who have taken the time to be here to be able to provide advice and answer questions based on their vast experience. The individuals we have with us today are very experienced researchers who've conducted research from all over the world. So we're very happy they could be here with us today. So first, Dr. Joseph Lianza. Dr. Lianza is an attending physician in the Department of Emergency Medicine at Boston Medical Center and is an assistant professor of emergency medicine at the Boston University School of Medicine. Dr. Lianza's main academic interest is in global health with a special focus on emergency medicine, specialty development policy, and humanitarian emergencies. He works mainly in Iraq with additional projects in Pakistan, Bangladesh, Uganda, and Ecuador. Dr. Lianza is also quite interested in the intersection between climate change and health. So thank you so much for being here with us today. Next, Dr. Adam Malucio. Dr. Adam Malucio is an assistant professor in emergency medicine with an appointment in the Division of Global Emergency Medicine at the Alport Medical School of Brown University. He received his medical doctorate from the State University of New York at Stony Brook and his Master's of Science in Public Health in Development Countries from the London School of Hygiene and Tropical Medicine before completing specialty training in emergency medicine at the State University of New York at Downstate in New York City. Dr. Lucio also has completed focused subspecialty training in global emergency medicine research and clinical tropical medicine and hygiene. He has developed and carried research in South America, Africa, Asia, and the Caribbean. Dr. Lucio's research focuses predominantly on improving understanding of the prevention and treatment of infectious disease and injuries in low and middle income countries and the delivery of acute and emergency care. Dr. Lucio also serves as a humanitarian responder and board member for multiple non-governmental organizations working in healthcare delivery and development. So thank you so much for taking the time to be here with us today. A little bit about myself. My name's Emma Cortez. I'm a physician in emergency medicine and family medicine. I am a clinical faculty member with Jefferson Northeast in Philadelphia, and I practice emergency medicine with Indian Health Services in Arizona. I am the founder and director of the nonprofit organization, the Migrant Health Collaborative of South Jersey, which focuses on increasing access to healthcare for migrant workers who are working temporarily in New Jersey. I've had clinical experiences in Uganda and the Philippines, and I am currently and have been previously the PI and co-PI on multiple grant-funded projects. And I'm going to be starting a fellowship in global emergency medicine at Brown University this fall. Okay, so we talked about this last time. If you were able to join us last time, I just wanted to give a brief overview of what the objectives for this course is. What we want this to be is an introduction to grant writing. We are going to give a brief overview of all of the components, and we'll be providing resources for further and in-depth learning about these topics, including resources such as textbooks and handouts for you to be able to do more reading and learning. This is not meant to cover all the nuances of grant writing because that we will not have enough time to be able to do that. And we aren't focusing on grants for bench research or laboratory research. If you are able to become more comfortable with these techniques, it can be applied to quantitative research, but conceptually it's much more straightforward to talk about it, not in terms of bench research. We will not be able to provide details specific to different countries, but we will provide references for resources for grant seekers outside of the US. But again, that's why we really want you to become members, because then moving forward, we can tailor these more directly to what people want to talk about, and we'll talk about more specific components in depth. The course curriculum is mostly borrowed from these 3 textbooks. If you are new to grant writing, I highly recommend that you obtain a digital copy or hard copy of these books. They are extremely helpful and they really walk you through the grant writing process. And they also provide examples and sample proposals for you to be able to look at to help give you an idea. Okay, so today we're going to be talking about the methods and experimental endpoint section and the budget section. So each of them has a lot in each of these components. So we're going to kind of dive right in and try to get through it as much as we can. The budget session, I think we're actually going to do another series where we focus specifically on budget writing because it is just very, very complicated and there's a lot of nuts and bolts. And we'll be able to talk about it fairly in depth today. Keep in mind that in the future, we really do want to do another series focused specifically on this, the method section. So this section of the report will spell out the methods to be used and give the reasons for choosing them. This can also be referred to as the strategy section, but ideally it systematically walks funders through the strategies the researcher proposes to carry out in order to accomplish its goals. It answers the key question, how will a researcher actually accomplish their work? And it examines the approach of how you will go about answering your research questions or addressing your aims in conducting your research study or project. So again, this should include an unbiased approach in the design, recruitment of participants, procedures and measures, human subjects if relevant, timeline, analysis, interpretation, and reporting of results. This is a list of suggested content if applying for grants such as NIH grants or similar. And this is from the third textbook on that slide. And you can see it's the same thing, but they can have different titles sometimes. Okay, so it will explain how your project activities will accomplish your objectives. It explains who will be doing which specified activities, when they'll be doing them, and how and when they will be done. Each component should be described in sufficient detail to establish credibility. So the main things that you're going to be covering in your methods to answer these questions are key personnel. Who are the key personnel? What are the project activities? And how is the project going to be managed? And then the questions you're going to be answering with that description is, what are the elements that are inflexible? What activities need to be carried out in order to meet the objectives? What are the starting and ending dates of these activities? Who has the responsibility of completing each activity? How will participants be selected? It's not applicable to all projects. And how was this methodology determined to be the best one to solve the problem presented? Does it build on models already in existence, or is it a different approach? And if it is different, then why is it different? And why did you select this specific approach? Okay, so key personnel. This is going to be discussing the staff who will be conducting the project, the subjects participating, and the collaborators who are going to be joining you in conducting this project. So the staff, you want to name all key project staff, including consultants and subcontractors in your proposal. If all people are not known yet, include job descriptions for the people you propose to hire or select. At a minimum, describe the major roles each will play, whether they're already on the project or propose to hire. For example, liaisons with project collaborators, volunteer coordinators, recruiters, or participants. Your appendices or otherwise designated section of your grant should contain brief resumes or bios that stress the relevant training and experience that will transfer to the proposed project. To enhance credibility, add the number of years your staff has worked in this area and mention the total in your proposal. Our project staff of 6 has a cumulative 119 years of experience in dealing with this issue. So that tells the reviewers that you have the necessary expertise to be able to carry out this experience.
So that's a good overview, and key personnel are very important, particularly in the NIH world. It's thinking about if you're the principal investigator, you're the main person who's putting in the grant, or it's a multiple PI grant, that's fine. But your key personnel should sort of complement the areas of the work that you don't necessarily have the expertise in, right? To kind of build out your team. That's really what you're trying to do with it. There shouldn't be people on there who are superfluous. I know that happens sometimes, sort of just for name recognition. If they don't have a role that will kind of flag you, and when you go to study section and for review. The other part of that is redundancy. If you really only need one person to do the job, don't put down 2 key personnel just to kind of buff it up. You want the best person for the job in these sort of funding streams that are happening in the contemporary kind of research space. You want to just try to be as efficient with the key personnel as possible, but ensuring that you have all the bases covered for the methods that you're going to do.
Thank you. Yeah, exactly. Specifically to your point about the staff, you want the reviewers to know that you have a track record related to this. And if you don't have a strong track record, then you can borrow the credibility from other field experts that are collaborating on your project. That being said, reviewers can tell if someone is added to the project just for their credentials. That's why you want to make sure that you articulate specific roles that people are going to be fulfilling. That way they know that they're not just added on there. So next, the subjects participating in the project. So most but not all grant projects involve interactions with some target audience, usually called the subjects, clients, patients, or participants, who are your ultimate focal point. Often these projects involve some research training, service delivery that interfaces with people. Your methods section should answer specific questions regarding this target population. How will you identify, recruit, and retain your subjects? For example, all patients between the ages 6 and 16 years old seen in the emergency room during the past 12 months will be contacted to solicit their participation in this project. This lays out specifically who it is going to be, how are you going to obtain these people, and through what timeline. So gives a very specific idea of who these participants will be. What are their basic demographics and socioeconomic characteristics? So another example, all subjects must live within the 4-county area and have access to transportation to be compensated by the project. So that describes the demographic of the people that will be involved in your project. How long will they be involved in the project? The subjects will participate in 3 2-hour focus group sessions. And then to what extent do the special client issues need to be addressed? For example, compromised health status, transportation barriers, restrictive home environments, unsafe neighborhoods, limited educational opportunities. So for an example, since our HIV clients would risk unfavorable publicity if they were identified by name, all records will use fictitious first names only, and only the project director will have the master list of record identifier numbers in order to ensure confidentiality and respect individual privacy. In that way, it tells the reviewers that you are specifically addressing the needs of your key population, and you're being very specific and know exactly the population that you're dealing with and that you respect their needs. Now, project collaborators. So a collaboration is defined as an interaction between 2 or more persons or organizations directed toward a common goal that is mutually beneficial. In essence, project collaborations are valuable for information, solving problems, and creating increasingly sponsors encourage collaborations. Collaborations show a large buy-in to projects and increase the likelihood of sustainability beyond the granting period as project components are institutionalized. So in practical terms, this means that collaborators can communicate through preferred formal and informal means to agreed upon intervals. They can share human, physical, and financial resources such as equipment, instrumentation, databases, personnel, target populations, business office services, intellectual property, and cash and in-kind contributions. In a successful collaboration, the whole is greater than the sum of the individual parts. All collaborators must identify what resources they will bring to the table and their preferred channels of communication. Collaborations can range from casual to formal relationships, such as informational collaborations, consortia, or interdisciplinary teams, or centers or institutions. Picking a collaborator needs to be done carefully, for it has long-term relationship and financial consequences. So now describing the project activities. Okay, so that will be captured through describing the justification of methods, data collection, relationship of objectives and methods, and the project timeline. All of these need to be within this component to be able to fully describe to the reviewer your activities. So justification of methods. Each project will have its own unique set of methods, activities, and tasks to accomplish the stated objectives. Whatever methods you deem appropriate for your project, justify their selection. Reviewers will want to know why you chose this approach and not some alternative approach. A few sentences of methodological justification prior to describing specific project activities will anticipate and answer questions in the mind of the reviewers of all of the possible methods. Why did you pick this one? As an example, the method of choice is to use a double-blind study. It is the only experimental design available that can isolate the effect of the independent variable on the project outcome.
So that explains why you're choosing this over a non-blinded study.
Sometimes it's equivocal, right? You can use different types depending on your research questions. So just being clear on that. And also particularly in the work we do and with collaborators overseas, using the beneficial aspect of a specific design for the people you're working with as well. Particularly if you're doing trial level work or systems level work, doing a step wedge versus a parallel randomized trial from a cluster trial perspective, if there's concern that the distribution of the intervention might not be acceptable otherwise, so along those lines. So just kind of everything's okay, you just got to be able to defend it.
Yeah, exactly. And why this section is very important, because exactly to your point, there's so many different kinds of methods. And so choosing the right one for your project and then being able to justify it is going to be critical in your proposal. Another example, this one describes that since it is imperative that we have the broadest possible community input in the most cost-effective manner, our approach relies on the time-proven benefits of using focus groups, a survey procedure that the program director has successfully used in similar past situations. It's describing a completely different method, but it's describing why, which is that it's cost-effective and that the program director has had experience with it in the past so that they know what they're doing with this. So that can help instill confidence in the grant seeker. So data collection, you'll probably need to collect some data as part of your project. Common types and sources of data collection include, but there's a lot of different kinds of data collection, and I have a table, but it did not make it into there. So, but there are different ways to figure out what would be the best way to collect data. And you can either construct your own data gathering instruments or use existing ones. To find out whether an appropriate instrument already exists and avoid reinventing the wheel, you can consider looking at reference books that list available tests in many different fields, and they can contain descriptions and reviews and critiques by several experts in the field. One example is the Burroughs Mental Measurements Yearbook. So this has a list of innumerable different tests, and you can either purchase a whole book or you can search for a test directly, and then you can look, it will describe to you the test, how it's used, and then give its critiques from other experts in the field and show its reliability and validity. And so no matter what kind of way that you're collecting data, you want to be able to describe the validity and reliability of that data collection method.
And along those lines, you want to, whenever possible, which isn't always the case, ensure that the reliability and the validity at least has some application in the setting you're working in for global health. There's a lot of cultural aspects, language aspects, maybe existing within the places you're working where maybe a specific tool on whatever mental health or PTSD or whatever hasn't actually been evaluated and validated there. And that's a barrier in a lot of places, right? Because what it means to be depressed 2 days a week somewhere doesn't necessarily translate to other places. If you're designing a project given a given location, try your best to use something that's already been done there and use the tools that have been validated there. And if they haven't, then that's okay. You just need to acknowledge that and tell the reviewers that there's currently no validation of this, but we'll evaluate it during our work, which also builds your application and adds to the overall body of tools that exist in the world for further research, and reviewers like that.
So the relationship of objectives and methods. So in this, your methods tells your reviewers how you accomplish each objective. So you can include one or more methods for each objective. So some people will rewrite the objective in their method sections just so that they can refer to it to make things easier for them, even though this is already in the previous section. So this is an example of that, of how they list the objective and then they describe exactly how they're going to be doing that, and then their process tasks there. So project timeline. I highly recommend using time and task charts. So the use of time and task charts represents one common and successful means of clearly communicating the method section in your proposal. This visual device segments your total project into manageable steps and lets your reviewers know exactly who will be doing what and when. It tells reviewers that you are organized and you have thought out the major steps of your project. This way, your reviewers know that you have done significant planning and how you will be a steward of their sponsorship, which is very important to them. And finally, the time and task charts represents a clear one-page visual summary of the entire methodology. So this is an example of that, of when things are going to be done, who they're going to be done by, and what the activity is. It makes things much more easy to understand for reviewers. Your project management approach represents a disciplined way of organization, allocating, communicating, and managing your human, physical, and financial resources that your project successfully meets its objectives on time and within budget. More specifically, your resources include money, people, materials, space, supplies, equipment, quality control, and risk management. Your project management plan in your proposal describes how you administer your grant. So as an example, this description says, our project management team represents the governance body that provides project leadership and oversight. The PMT bears the ultimate responsibility for ensuring successful project completion. The PMT includes the project director, Mike Johnson, and the team leaders in our 3 program areas, housing, jobs, and education. Collectively, this 4-person PMT will be responsible for successfully integrating the services that empower inner-city single mothers and their families. All teams must rely on collaboration with community partners and various resources they offer to our target population, as the following PMT organizational chart indicates. And this is the chart that they're referring to. So again, it's clearly spelling out who is going to be responsible for what task, how they're going to be doing that. So I'm not going to read this whole thing, but this is a continuation of that example I was just showing. And so as you see, not only do they list who's going to be doing what tasks, but then they explain exactly how they're going to be addressing each major project issue and when, and what their responsibilities are specifically. And then within this, it also gives in the time frame. So this is from one of the textbooks, the one all the way in the middle, which I'll go back to later. And again, you'll be getting a copy of the slides will be available, so you can read this more in depthly. But the whole point is to explain very specifically who is going to be responsible for what activities and when it's going to happen. Let me see.
Yeah, and the tables and figures are good for this because space is a commodity. In a grant application, you've got at most 12 pages to talk about your research strategy, and that's everything, right? For smaller foundation grants, it's somewhere generally two. So you need to be efficient with how you're presenting this type of information. It's important, but you just have to present it well and concisely.
Yeah, exactly. And that's why a visual chart such as this that has the timeline, the budget, and who can really help save space as well and maintain clarity. So this is another example of a table that you could use that spells out who is going to be responsible for which initiative and when it's going to happen. So the important things for writing the methods section is you want to justify your selection of methods, describe what is unique about your approach. Have others use your procedures? Is there a solid reason to believe they will work? Is the approach sustainable? Why did you choose your experimental method specifically? Be sure to discuss who will be served and how they will be chosen. Pay attention to your project scope. If you find it difficult to include everything that you want to address, the scope may be too broad. If you find there's only one objective, for example, to buy a piece of equipment, and the method section focuses on the instrument as an end in itself rather than as a means to a larger end, then your scope may be too narrow. Segment your methodological approach into activity areas. This organization makes the project design easier to understand general, and using subheadings can help maintain that clarity for the reviewer. Including a time and task chart, listing the names or titles of personnel who will carry out the project foreshadows for the reviewers that the role of each person plays in your project. Establish the credibility of key personnel to perform the planned work. Identify academic degrees, relevant education, experience, training, awards, and recognition received. Restate and summarize your objectives at the beginning of each major activity area. If you are generating data, explain how you will collect, analyze, and interpret it. Describe the survey tools that you will use, including reliability and validity characteristics. Explain how information collected will be used to monitor program progress and indicate when final reports and outcomes will be available. Spell out the facilities and capital equipment that will be available for the project. And lastly, tie the methods to the resources being requested in the program budget. Each activity should match its corresponding cost. So to start writing your methods questions, you can start by trying to answer these questions that we had already talked about in the beginning, and addressing each of these questions will help you start forming the description. This is a handout that will be provided that sometimes help you kind of sort your thoughts out to be able to start writing that. And then once you address all of these questions, you can review the method sessions and trying to determine whether or not you were able to accomplish answering the questions, do the methods discussed in the proposal, derive logically from the problem statement and the goals and objectives. So are you answering the research question that you proposed with your methods? Do the methods present the project's activities to be undertaken? Has the grant seeker explained why they selected the specific methods or activities? Has the grant seeker explained the timing and the order of the specific activities? Is it clear who will perform specific activities? And do their credentials and or experience demonstrate that they are appropriate to carry out the activities of the program? And given the organization's projected resources area, the proposed activities, are they feasible? So one thing that you may hear often is under promise and over deliver. You want to make sure that your goals are feasible for you to be able to obtain, and that way they're achievable. And then that way you're not setting yourself up for failure for something that you're not going to be able to accomplish given the circumstances. I added here just a brief list of reasons for rejections. I saw that in some of the registration people were interested in why proposals get rejected. So this is a list of statements from reviewers that have rejected different proposals and why. So these are just a few examples. So for the description of the personnel, they felt that it was not specified in the narrative who the project staff will be, and their descriptions were not included. The applicant does not provide any indication of the number of clients participants to be included in the study. While the timeframes are provided for each milestone, the applicants do not indicate who is responsible for carrying out each activity. There is insufficient experimental detail to approve the project. The proposal narrative does not describe why the target population will be selected over other populations. And there is a gap between the problem identified and the solution. So that was what I was saying. You want to make sure that this is answering the question that you initially proposed and the problem that you described in the problem statement. You want to make sure that you're providing clear and appropriate timelines. Grants have been rejected for no timelines are provided with the major tasks. This represents a serious planning gap on the part of the applicants. It is not clear how easily the project would be partitioned into discrete phases. That can be important to reviewers. Does anyone have any questions about this part so far?
And I'm not sure if you're going to go into it, but another sort of section that wasn't explicitly identified in your sort of overview is potential downfalls, potential limitations, potential barriers. There's no study is going to be perfect, and there's always going to be problems, right? If you can kind of predict where the weaknesses are in your initial application and kind of outline that for the reviewer, because they're going to pick it up, right? Acknowledging that and at least providing some information on why you think it's less of an issue than it may be, or how you're going to actively address it can go a long way in terms of like, all right, well, they thought of this. All right, that's good. It still might be a problem, but at least they're taking steps to ensure that it's addressed the best that it possibly can be. Particularly that's around sort of like patient recruitment or specific sensitive data information. So if you've done work prior and we're planning to enroll 500 people in this study, that sounds like a lot. We've done this 3 times before in the same site. That helps the reviewer say, okay, well, these people can probably do it then, right? So just kind of adding that in if there's space at the end can be helpful.
Yeah, exactly. Thank you. Because I mean, any kind of prior experience that you've had or any kind of track record with it is going to lend credibility to why you're choosing that method. If there was success in the past, that will always help provide credibility. Okay. All right. So we'll move on to the second part of this, which is the evaluation. So the next step is planning how the researcher will evaluate what they propose to do. Evaluation is a process that determines the impact, effectiveness, and efficiency of a project. It reveals what worked and what did not work. So always keep in mind that funders expect to hear from researchers how they define and measure success of a project, whether they explicitly request an evaluation. So you may engage in different types of evaluations to assess the effectiveness of your proposed project during the project, at the conclusion of the project, and after the grant period. So during the grant period, you will be evaluating the process. Other terms that you may see are structure, process, initial outcomes, or formative. At the conclusion of the grant period, you'll be evaluating your short-term outcomes, also called outputs, summative, intermediate outcomes. And then beyond the grant period, there'll be the long-term outcomes, also known as impact or end outcomes. So process evaluation. So this will allows you to examine how well the project itself is working. Evaluation indicators are specific characteristics that you will track and measure to gauge project success. You may consider the structure, environment, and settings in which your experiment intervention occurs. You should assess your organization or research teams, the target population, and the community environment. Are sufficient numbers of key personnel adequately trained to carry out the project? Are suitable facilities and equipment available? What obstacles are being encountered and how are they being addressed? Examples of assessing your intervention would be, what is the intensity of the intervention? Who provided the intervention? What type of intervention was used, where and when the intervention occurred, and length of the participant involvement. So your short-term outcomes, these are that occur at the end of certain milestones in your project delivery, possibly even at the end of the project itself. These examine the extent to which the project did what it was designed to do and the strength of the effect. Was your project a success as you defined it? So a few types of outcome indicators are functional status, humanistic, academic productivity. So just going back, so for functional status, these are indicators that demonstrate that as a result of the intervention, the target population's quality of life improved in a meaningful way. So these can be performed measures that are evaluated at set intervals, such as prior to the intervention and at 6 and 12 months post-intervention. For an example, it could be a reliable, valid, person-centered standardized items that measured functional status and need for assistance with everyday activity. So this could be like a survey that you're using to measure somebody's functional ability and whether or not this was improved with your intervention. Humanistic indicators. So these tell you how the awareness and attitudes of the target population have changed over time and reflect how well the project is working. These measures tend to be subjective in nature. For instance, awareness of program services or access to services, conveniences of services, or satisfaction of services. This is typically measured by administering the appropriate attitude scale. It is a key outcome measure because those who are satisfied with their experiences are more likely to continue participating in the intervention. Note that the target population satisfaction can be both the measurement of process or outcome evaluation depending on where it occurs in the evaluation plan. When measured throughout the project, client satisfaction can help you improve the structure of the project and make mid-course corrections. When measured at the end of a project, it becomes part of the outcome evaluation. So academic productivity, this is a measure that can highlight the values of investment, like if this was a project that looked at the investment in education. So indicators can relate to different types of academic achievement, whether it's through student learner achievement teaching, such as looking at it, and then scholarship service. These are all things that you're able to measure For student would be looking at standardized testing scores or graduation rates. And then for teaching, it could be looking at the creation of new courses or the amount of students supervised in a research setting. And then for scholarship, you could be looking at rates of publications or rates of citations, scholarly presentations, or you could also look at service appointments, whether or not there are students that are becoming more a part of different committees or outreach organizations.
And when you're writing these grants, be cognizant of who you're asking the money from, right? Because what their mission and their agenda is will not dictate, but should guide how you plan to evaluate what your outcome metrics are going to be, right? So if you're applying for a training grant, right? So something like a D43 or something through the NIH, where the goal is to train people in other countries to be better at research, then you want to have academic productivity as your outcome metric, right? But if you're applying for an implementation science grant to improve care delivery, you're going to have a completely different framework that you're going to approach the outcomes with. There's no wrong outcome. You just have to make sure you're picking the ones that are, one, relevant to the work, but also two, kind of mesh with what the people who are going to sign off on it really want to see as the outcome.
Yeah, and that's a great point. And we kind of talked about that in the first session, if people were able to join us, for making sure that you address your problem and focus of your project in line with the vision of the funder. We want to make sure that you're addressing concerns of the funder because they are interested in funding your objectives. And so your objectives should be in line with their mission or their vision. And so exactly to your point, that's if they're interested in teaching, then they want to be looking at, they could be wanting to look at student achievement or teaching achievement. So, and then the other outcome indicator is economic. And so there's there's 5 measures that typically are used to calculate the costs and consequences of project interventions. And this is another topic that could easily be another hour to talk about because it's pretty involved and is more involved in the financial aspect. But just to give a brief overview, there's cost benefit analysis, which is to identify the most favorable cost to benefit ratio of 2 or more alternatives that have similar or different outcomes for the target population. So that is given finite resources, which project intervention gives the best return for the amount of money invested. Cost-effective analysis compares 2 or more approaches with the specified outcome, assuming that members of the target population value the outcome equally and that adequate financial resources are available to pursue the most beneficial strategy. There's cost minimization analysis, which identifies the least expensive of 2 or more alternatives that have identical outcomes for the target population. Cost utility analysis compares the cost of 2 or more approaches with an outcome. And then return on investment analysis looks at projected benefits or revenue generated by the intervention over a period of time compared with the initial investment and operating costs. So long-term outcome evaluations. So these generate information to measure the overall worth and utility of the project beyond the granting period. So it is called either end outcome or the impact evaluations, and they focus on the project's larger value. So the long-term, the fundamental changes in, say, participants' knowledge or attitudes or behaviors. This is going to be going on after your proposed project. Improving the outcomes at a project level may impact changes over time at the community level. So often this is larger scale. Lasting change is why sponsors are making the grants in the first place and align closely with the sponsor's value. Their overall goal is usually not to fund a specific project. They may have a vision of help increasing education in an area or helping increase access to healthcare services. So your long-term outcome evaluations are going to show how your project is in line with that vision for specific different kinds of grants. Having a plan to demonstrate what is learned from your project can assist similar organizations in how your project can have a long-lasting ripple effect, can persuade the sponsor that your project is worth investing in. So also at any time, if you're having trouble hearing me or if there's any background noise, just let me know and I can put on a microphone. So just let me know. Okay, so the overall value. What enduring changes will occur in the participants as a result of this project? Over the long term, will you be able to demonstrate that the project's impact extended beyond the target population to the entire community, area, or region? Will this project serve as a catalyst for other related community action, service, and projects? Not every project this is going to be applicable to, but these are the kinds of questions you want to be able to address that may persuade the reviewer to why they should fund in your project specifically. If it has a long-term value, that may be more enticing enticing for them to fund. Sustainability, will project activities continue beyond the granting period? Will you be able to mobilize continued support for the project internally and or externally? Will your team institutionalize strategies deemed effective? Will key champions for the project be able to increase levels of community involvement for fiscal support? Will your project influence changes at provider, policy, system, or environmental levels? So can your project be replicated? So will key findings be disseminated to local, regional, and national and international stakeholders so that the project can be replicated? Does the project's design have flexibility to be adapted for other populations, topics, or conditions? Does your project have the potential to serve as a public policy model? So, this was an example that Dr. Lucio had mentioned earlier. If you're doing a project that maybe hasn't been done in your area before, you can describe how in your long-term outcomes, this is going to be able to provide more information towards that issue or towards that goal, which is lends to your project and why it should be done. And then some other projects, you can argue that the results of this project may be able to help influence policymakers in a certain area, which can be very important to different funders and grant makers.
I just added a lot of this is sort of theoretical projections, right? Your grant's gonna be 5 years, and it's very hard to have these levels of impacts within a 5-year period, particularly if you're trying to explore a completely new area of research. If you're doing some type of implementation science specifically designed for capacity building, then potentially you could have these outcomes. But a lot of this is immensely important, but you just want to make sure that you're being realistic. Like, you're probably not going to change policy in 5 years with a single research project, right? But we can, by engaging the right stakeholders, provide the results to the people who inform policy, and that can help kind of move the needle in that direction. So again, kind of what Emma was saying about not over promising. You want to say what's possible, but also be realistic and what's probable.
Can you speak to more what kinds of things you could describe that would be realistic, but also the impression that this should be funded because it could have long-term outcome?
Yeah, no problem. A lot is going to be dependent on the type of work, right? And sort of the methodology. If you're mentioning sort of educational training projects, those you can build around hierarchy of Kirkpatrick, hierarchy of change for education, where it's versus sort of like knowledge translation, then it's change in practice, eventually getting to like patient outcomes, right? So kind of putting in what realistically we're going to do the first 2 steps in this framework, right? And that can lead to the subsequent steps, which actually have patient level impacts. If you're evaluating a new medication or a specific treatment, that's going to be kind of more along kind of how we can change policy for delivery. So think about something like the CREST study for tranexamic acid, right? That was sort of game changing in terms of how injury care was facilitated in low and middle income countries, particularly less so in higher income countries for a multitude of reasons. But with a trial like that, right? Okay, now we have at least the best empirical evidence that we can that this makes a difference in patient impacts, right? So now we can take that to policymakers, and it becomes a essential medicine, right? And then it gets trickled down to other ministries of health as a medicine that people need to have in their facilities around the country. For things like programmatic work and change over time, the sustainability and the maintenance sort of component is something you can build into the work, and kind of how you'll engage the people who are actually on the ground doing it to kind of speak to how you'll maintain sustainability. But again, it's kind of hard to do over a relatively short period of time. It's kind of a lot of it's project specific. You kind of just have to think about how you can do it.
Do you think it's useful to use terminology like this can lead to this, or it opens the door for this possibility? That
has the potential, will be informative too. Those are all good phraseologies to use kind of as you're writing what can happen with it. And another thing we commonly do, particularly like larger grants where people may not be specifically a key personnel or a member of the research team, devise like a scientific advisory board made up of people who are from the area you're working in and kind of sit within different spaces that are going to be pertinent to the results. So like you've got somebody from the government who works in policy, if somebody who's on the committee or the specialty board for whatever the work you're doing is, somebody who has expertise in a specific type of research within the country, right? So they kind of interact with you throughout the study period, and also are players in terms of actually using that work and the outcomes of that work locally afterwards. You don't always have room on every grant for people like that, but if you're doing something semi-large, it's good to have those additional people listed.
Yeah, that's a great point. Thank you. So logic models, they're typically a one-page visual description of the entire evaluation plan, and they can take many different forms, but typically it shows the major project components, the work planned, intended results, the hypothesis, and the formative and summative evaluation domains. So usually the missing information pieces are the who and the when, which presumably are indicated on a time and task chart. Logic models can be a valuable tool for explaining the overall project as well as the rationale behind the different parts to obtain buy-in from both internal team members as well as external partners. Let me see here. So a logical model illustrates the relationship between a current situation, process, the resulting outputs, and short-term, medium, and long-term outcomes. And although they vary, they typically move from left to right and show the relationship between the inputs, the resources you will need for your project, the activities, your project that you will do, the outputs, which are the deliverables or products, and then the outcomes, which are the impacts on the participants. So this is just a couple different examples. There are a lot of different ways to make logic models. So again, that's something that it could be a whole another topic of how to make these and how best to do it. But the overall benefit to that is, again, like if you're limited on space, this can kind of help lay everything out for the reviewer so they can see exactly what you're talking about and see that you have a long-term vision of your project. So just to make a mention, which is a shame that we can't go more into it, but I just want to mention terminology that you may hear or you may see in grant descriptions, just so that you're aware of it and you've been exposed to the terms. But there is, in terms of evaluators, there is something called an internal evaluator and external evaluators. So evaluations can be done using someone within your organization or outside of your organization. Some grant competitions might require an independent evaluator and allow the cost of that evaluation to be part of your overall budget. But there are ways to find good evaluation consultants, whether through the grant offices of an academic society, or there's also independent evaluation resources through other organizations such as the UN. And I thought I had it on a slide here, but I don't have, but we'll have that on the slide for the next session. So whether you're using an internal or external evaluator or both, this could be something that you want to include in the proposal. So writing the evaluation section, you want to make sure that you're describing what will be evaluated, what information will be needed to conduct the evaluation, where will that information be obtained, who will collect the data, what data collection instruments will be used to get that information and why, with what frequency will data be collected, will historical or baseline data be required for benchmarking, what evaluation design will be used, what analysis will be completed, and by when, and what questions will you be able to answer as a result. And again, not all of these questions are going to apply to every project, but these are the kinds of questions that you would want to address depending on what your project is and the scope of the project. These are handouts that can kind of, again, help you start answering some of these questions just so that you can sort your thoughts and get an idea. Again, not all these questions are going to be applicable, but if you go through, it can sometimes help start the process. And so these are tips for evaluating whether or not you were able to accomplish your main goals. I'm just making a note of the time. We're pretty far into there. Are there any questions so far? So I wonder if it might be more beneficial if we go over the budget, or we start the next session with the budget, just because, again, this is something that is actually really in depth and it has a lot of different, each stage of the budget writing has a lot of different steps in it. And I want to make sure that we have time to go through all of the terminology and vocabulary and resources of how to write a budget and how to assess for revenue and expenses and things like that. So it's something that we might actually go through in the next session. That way we have enough time to address all of it. Let's see. Dr. Leonza or Dr. Abu, who's able to join us, do you have any other comments or suggestions or advice for writing the evaluation and methods section?
I think you covered everything really well. The one thing that I've found useful in the past is to have an unaffiliated friend or colleague read through the methods section, which seems like pretty obvious and basic advice. But if you're really ingrained in your research project and what you're interested in achieving, you may find things to be intuitive within your methods section that are not intuitive to someone who is not involved in your research. And sort of having an unaffiliated party read through and try to articulate your research back to you can be extremely helpful, I think. That would be the one thing that I would add.
If you don't want to assume that the reviewer knows everything about your project team or about your institution and that they know what your goals and missions are, that may not be something that comes across.
Yeah, correct. I've found glaring holes by doing that in the past, and it was extremely helpful for me.
And on a similar note, but more so on the evaluation, I think we assume that especially our grantors are fully, something we talked about in the last session, our grantors are fully knowledgeable about the details, the scope of our projects. So when you're writing for your evaluation, I guess maybe on the same note as Dr. Leandro was saying, having someone who is not fully knowledgeable of your project's details or even the area, someone who's outside of your area, looking at the evaluation, because sometimes we overdo. I don't know how to put this, meaning that we are highly strict on ourselves and it ends up backfiring a little bit because the goal is just to set certain parameters that both you and whoever is funding your project would be satisfied with. And we do it from our perspective, and sometimes we are extra strict on ourselves. So the way that to prevent that is by having individuals who are not in your exact domain be able to take a look as well. So it's the same kind of concepts, but instead of methods in the evaluation sector.
Dr. Lucio, do you have anything else that you wanted to add for these two sections?
I think you covered everything. I mean, the high points, it's efficiency is really the importance in this, and clarity, right? I think as was mentioned, the reviewer is not going to know to have the depth of understanding of the work that you do when you're the one writing it. So just making sure that it's really hit them over the head with kind of this is what we're doing and this is why, right? And this is why we need to do it this way. Don't make any assumptions, because even if it's in there, people are going to miss it. So say it a couple of times, right? Kind of throughout, you get feedback and from a review and they say X, Y, and Z wasn't done. You're like, well, in this paragraph it explicitly says the answer to that question, right? And so it's just sometimes you have to reiterate things throughout the work, and that's okay. There's people are reading a 200-page grant or whatever, and they're reading 4 of them, to give feedback on. So it's understandable, but just being deliberate, kind of that sort of obviousness is important sometimes.
More to that point, there are certain tests that we use, like surveys and scales that we use all the time that we may take for granted, that people assume why we're using this scale, or like a pain scale or something like that, or like a psychological survey, like the mini mental status exam, that we use these things all the time. You still need to explain the validity of this test and why we use it so generally and things like that, because you can't just assume that they know that, like, oh yeah, of course we're going to use this. So you want that to be very clear, even if it may seem like possibly common knowledge. So I wanted to go to the last slide just so our next session is going to be on next week. And so we are going to talk about the budget next week, and we'll be able to have more time to go into it in depth and be able to cover everything because it's pretty involved. But one of the most important things about next week is that we're going to go over finding sponsors, pre-proposal contacts, and planning proposals, tips around submitting the proposal, and then how to find funding resources. And all of this will be geared towards researchers that are not in the US, how you're finding sponsors and funders if you are primarily based outside of the US. The planning and pre-proposal contacts and submitting will also be focused from that lens as well. So we really hope you can join us. And again, we really look forward to you all being involved and helping us plan the next series and continue to make this more focused on what you all feel is most important, especially our colleagues who are outside of the US. So we really appreciate your feedback and are really interested in it. So we really hope you can join us next week. We will be sending out the slides and the handouts for people to be able to use. And that is my email. If anyone ever has any questions, please feel free to email me at all. And if anyone else have any other questions before we wrap it up. So we'll make sure that we post how people will be able to access the recording for this too. So we'll make sure that that's available as well. All right. Well, if there's no other questions, thank you so much for your time. Really appreciate you all being here. And thank you so much to our panelists for taking the time to be here. We really are very appreciative. So thank you so much. And we look forward to seeing you next week.